In the challenging landscape of peripheral artery disease treatment, patients often face moments of profound vulnerability and uncertainty. During these critical times, the quality of human connection with their physician becomes as important as the medical interventions themselves. Dr. J.D. Corl exemplifies the transformative power of combining clinical excellence with extraordinary compassion. His practice demonstrates a fundamental understanding that treating PAD effectively requires addressing not just the disease, but the entire person experiencing it. What distinguishes Dr. Corl's approach is his unwavering willingness to offer hope when others have given up on these patients. For patients facing amputation, especially who have been told they've exhausted all options, he consistently steps forward to provide one final attempt at limb salvage when medically appropriate. This willingness to accept transfer patients in dire circumstances speaks volumes about his commitment to patient centered care. Beyond these critical interventions, however, patients consistently highlight the quality of attention that he provides. In an era of rushed medical appointments, Dr. Coral creates space for patients to express all of their concerns and their questions, staying with them until they feel heard and truly understood. As one patient noted, quote, he treats every question as if it's the most important thing he has heard all day. And I know that is not always the truth, but he makes me feel that way, unquote. Perhaps the most remarkable in is really his exceptional accessibility. We've heard accounts of Dr. Coral personally calling patients while they were in transit to the hospital, ensuring they knew he was aware and available to help. A small gesture with an immense impact during moments of crisis. Through these everyday acts of extraordinary compassion, Dr. Coral reminds us that the most advanced medical interventions achieve their greatest potential when delivered with genuine human connection. So please join me in welcoming our 2025 U.S. Compassion and PAD Care Award recipient, Dr. J.D. Coral. Thank you for all you do, Dr. Corl, to not only save life and limb, but to be truly there as a partner and friend in care for these PAD patients. We appreciate you so much. And I just wonder, in getting this award, I mean, is this something you think about on a daily basis, or is this just deep down to your core who you are?
Well, first of all, thank you very much for the introduction. Very kind words. I appreciate the recognition with the award. Great honor. We do a lot of hard work. It's not just me, it's a whole system that works together. So I really appreciate it. And we do work hard. I mean, it is a challenge. You know these patients better than anyone, that they need a lot of support and guidance. And they're going through a lot more than just the CLTI or critical limb ischemia. So there's a lot going on, and we do our best. And you're a great advocate. You've certainly helped us with a lot of patients and helped a lot of patients get in the right hands. So I do appreciate that. But yeah, I think this is just who I am. And, we enjoy doing it. We like helping these patients. They all have got a story. They're all unique to themselves. So we take them all on and do our best.
Was there ever a moment in your career? We know that every doctor gets into it because they want to help patients, right? But so many doctors get lost in the daily, grind of documentation and 50 patients a day. Was there ever a time where you felt like you were getting lost in this shuffle and you had a an aha moment where you said, no, 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 I can't let this happen. I'm in this for the patients. And was there
Yeah.
maybe a patient that snapped you out of that? And it's not to come down. It's every single doctor tells me that they have experienced that moment where they have gotten wrapped up and then someone takes them back.
Yeah, I think you're exactly right. I mean, the system certainly takes you away from patients. You spend a lot more time on computers and clicking and doing charting and stuff, and that's an unfortunate
Yeah.
aspect of care now. But you do get these patients, and I think when you get in the room with them, because I don't bring a computer in there with me, I like to just be with a sheet of paper and the patient. And then it's sort of like just you guys, and that's sort of where you get your direct connection, like you're talking about, where you can focus on that patient. And then when you're doing cases, the same thing. You're sort of isolated from all the noise, and you're in there with the patient, and that's where your motivation and dedication is. So you're right, though. It is tough with all the other commitments and baggage, for lack of a better word, that comes along with all this. So I do think, it's just an ongoing process of trying to separate that. But I don't know if there's one patient or one moment that clicked me, but I think it's just sort of trying to fight all the momentum that's taking you into charts and paperwork and all that
Hmm.
stuff, and focusing more and trying to keep the focus on the patient themselves. So it's an ongoing struggle and challenge.
Yeah, I'm so sorry. You might have seen my dad kind of floating in the
That's,
background here. So I apologize for that. Sometimes he forgets that we are broadcasting live, but got to get those dogs out of the
yep.
room and off to the groomer. So thank you for your patience in that. But back to the topic. Patients, as I mentioned, you consistently say that you make them feel truly heard. Can you share a particular practice or communication approach that you've developed that helps establish this deeper connection with your patients?
Yeah, well, like I said earlier, everyone's got their own story, and I try to listen. I think listening is probably the key to this. I mean, so often people are checking boxes, like we got to get through all these things on the chart, and you really don't get into the story. And so I do try to listen. I try to ask questions and follow up questions. I think are important. But last thing you want is a patient to tell you something, and then you just jump to the next topic. So you want to expand on that and make sure it's explored and looked into, instead of just sort of, I don't want to say blowing it off, but you always hear about patients say, I told so and so this, and they just said it's old age or whatever and moved on. So
Yeah.
you do want to hear them out, you want to follow through. So I think that's probably the key: listening, and then following through and actually getting to the bottom as deep as you can get from a heart or vascular standpoint within your realm.
Can you share a specific example, or does any particular experience stand out where the patient may have come in, they may have documented with the nurse that they're there for a particular reason, and just in your approach and sitting and listening to them, you said, "Oh, wait, no, there's something else going on that no one has figured out.
Yeah.
We gotta act on this now." Maybe you even sent them to the emergency room, something that they didn't even expect when they walked in the door to see you.
Yeah, I mean, there's a lot of examples, and more of them probably cardiac. I've had whole myocardial infarctions here in the office that are like ongoing when I walk in the room. So it's probably more from a heart standpoint. You'll see where it's not exactly what was advertised or what was on the chief complaint that got checked in with. So, but we've walked into some rooms, and it's a lot worse than you thought, and it's a lot more acute than you thought. And this isn't just some urgent visit or add-on visit because of shortness of breath. There's more going on. So, yeah, you can definitely walk into that. More probably cardiac, but we see it with limb salvage too, with ulcers and gangrene, where you get in there and you unwrap them, and it's a lot worse than you thought when you got the call coming in. So you do have to accelerate and ramp up the urgency on those.
Based on your approach and really stepping back and really listening to patients, not bringing your computer into the room, just your pencil, paper, and really trying to connect with the patients. Beyond the technical aspects of vascular intervention, what do you believe, based on what you hear from these patients, is most misunderstood about the psychological journey that PAD patients experience? Particularly for those who are in the most advanced stages of critical limb ischemia, maybe at the point of critical limb threatening ischemia.
Yeah. Well, I think it's good to understand what these patients have on their calendar. Because we see our appointment and we may do a procedure, an ultrasound study, and it's sort of isolated. But when you start looking at, well, they got wound care weekly or every week, whatever it is, they've got dialysis, they've whatever it may be. These patients have a lot on their plate. So I think sometimes we get in our tunnel and we're looking at what we're doing and we forget about all the other things these patients have on their plate. And it's a lot. And you've seen these patients, and there's just so much going on in a lot of these patients that you have to kind of bend and work with them and make the schedules work. Otherwise, it's just too much for these patients. And it's a lot of commitment on their part as well as their family. I mean, getting them to these appointments and supporting them with, maybe they've already lost a limb, and that's a big lifestyle change, and not just for them, but the whole family.
I'm curious. There's a lot of coaching when you're dealing with PAD patients. There's a lot of, becoming that motivational speaker.
Yeah,
What is your best motivational speech? You spend a lot of time with these patients, you listen to them,
yeah,
I'm sure you customize your presentation every single time in driving home the importance of conservative measures, risk
yeah.
factor mitigation, eating right, smoking cessation. Maybe start with that motivational speech for smoking cessation and then give us your best walking is medicine
Yeah.
motivational speech.
Yeah, I don't know that I have like a speech or a routine. I mean, I try to encourage through example. I'm a very active guy. I try to eat right. I don't smoke, so I'm pretty open with patients, and we have a lot of talk about what I'm doing and what they're doing. And it's a lot of encouragement, I think, more than anything, a lot of feedback, positive feedback. You see these, I don't know if my background's blanked or not, but you see
Is it?
these egg cartons up here. So
Yeah.
those are eggs. I don't have a bunch of eggs, but those are golf balls. So I had a patient that I was encouraging to walk, and he just kept walking. He lived near a golf course or on a golf course, so he would go around as he walked and pick up golf balls. Then he would bring in a couple of egg cartons full of golf balls at his next appointment. Say, "Got you some balls? See, I'm walking," and it's just sort of his evidence that he's walking. And you can see how many I got. There's a lot more than that. And he gives them to our nurse practitioner. It got to the point where he was just bringing these in all the time. And he lived into his 90s, you know. So recently passed away, but great patient, great example of walking throughout his 80s into his 90s on a regular basis. But I think it's that encouragement. I think he looked forward to probably giving me those golf balls and then hearing how excited I was about the walking and keeping active. So that's just an example. I mean, I don't, the patient's got to want to do it, but I'm going to certainly encourage him and support him and kind of, I don't want to say lead by example, but encourage by example, because again, I do all this activity stuff. And so I got a lot of patients that buy in. The ones that buy in are great. Some are a little more stubborn. You just have to keep on them every appointment, just keep the encouragement going. But positive, I think, is the key.
But I think it speaks volumes to your character and why you're that 2025 US Compassionate PD Care Award recipient. You still have all of the golf balls in your office. The
Yeah,
fact that you kept them
yeah,
exemplifies who you are and why
yeah.
you are so deserving of this award.
Yeah, and it's a great conversation page. People come to my office and say, "What are the eggs for?" And then you got a story about, got to get out and walk. And this is a perfect example of how that walking program really can help a patient.
So, describe a case that you learned a lesson from that other physicians and clinicians can learn a lesson from. What was that case that really stands out to you where you thought, this is the greatest lesson I think I've ever learned, and others could learn from this? It could have been a success and it could have
Yeah.
been a failure.
Yeah, I think there's cases or a case, actually many cases, but I can think back one where, you're almost going to give up. You've been in there a long time. You've exhausted access points and different equipment and that, and you just, you're looking at the paint, you're like, all right, we're here, let's just try this. And you get through and it works out. So I think a lot of it is just the effort of maybe keeping going, not giving up after, one setback or whatever. Because these cases, they're challenging. You're going to have challenges. You're not going to be successful in all of them. You're going to have to try a little harder and go a little deeper in the toolbox for certain cases. But I think if the patient knows you're giving it everything, and maybe it's
Yeah.
you're the third attempt or whatever, and fortunately, the vast majorities are successful. I mean, we've got a 95% success rate on these cases on per lesion, not just the whole case, but so. But we all know they're challenging, and these peripheral artery disease, especially tibial disease and below the ankle disease, is very challenging. So the equipment's getting better, the techniques are getting better, we're getting more options, and we're kind of narrowing down those patients that we couldn't get through or couldn't treat. It's getting smaller and smaller with all the technology and advancements. So I think effort, to your question, effort is probably the key um, teaching
Well, you
point, learning point.
certainly make the effort. I remember a case, which I'm sure you remember fondly, where a patient, we had the daughter who was, her mom was on deck for amputation
Yeah,
in a hospital, I believe it was in the Dayton area. And I texted you and I couldn't believe, I don't know, I mean, what was going through your mind in that moment, what you were doing in that moment. But the fact that you responded in that moment and said, I'll transfer her.
yeah,
Give me the name. You got on the phone with the daughter, and I don't know what the political environment is like, in Ohio, but you fought for this patient. You got them
yeah,
transferred from Dayton all the way up to Cincinnati, which blew my mind.
yeah, yeah. Well, I'm at Christ Hospital. We're a big tertiary center. So fortunately, and it's not just vascular, but in the CTO world, in the chip world, and the valve, the structural heart and valve, we do this a lot. Where our partners, cardiovascular service line, will bring patients in from different hospitals. So the hospital is well versed in this. So for us to do it, it was pretty routine, at least for the hospital. So we're fortunate to have that kind of specialty in tertiary care.
Yeah, I feel so blessed, and so did the patients
Yeah,
that we've helped, facilitate,
yeah,
getting to you, and you've
yeah,
been so wonderful in helping them, and we appreciate you jumping every single time without question to say,
yeah,
don't just give me details. You're just like, how can I help? What can I
yeah,
do?
yeah,
Just tell me, give me the phone number. Let me call them. Let me get involved. And no matter what it is, you always are at least willing to entertain the story, the conversation, and that just means
yeah,
everything to us.
yeah.
Um, what was for you, um, because you're such a special human on this planet. I mean, what was the defining moment in your career that led you to where you are today, and who you are today? Was it a conversation you had with someone, some documentary, or something you read in a textbook, or a patient? What was the, defining moment for
Yeah.
you as you would see it in your career?
Yeah, I think, leading into this program, where we really got off the ground in 2016, we were sort of building towards it. And, there wasn't a lot of CLI programs or a lot of limb salvage work. There was some, but nothing like today. And so our hospital was sort of getting up to speed, and we're trying to figure out how this is going to fit in. And I was doing a lot of other stuff. I was plenty busy with coronary stuff and other aspects of cardiology. So I did a lot of peripheral work, but not like today, not like now. And I remember talking to Dr. Kariakis, who's, he's the best, and he's really built our program at this hospital. He's the one that draws everyone here. And we got all these great specialists, mainly because of him. I mean, he's set the culture, set the tone, and had a conversation where we're just, kind of working through this. And he basically told me, he said, if you're going to do this, you got to do it. So it wasn't, you can't kind of dabble. You can't keep all the other stuff. You're going to have to give some stuff up, and you're going to have to focus on P.A.D. and limb salvage. So that was sort of the conversation. He just looked at me and said, "You're going to do it. You're going to do it. You got to do it right." So from that point on, I think kept the focus there. And you do have to get rid of some other stuff. You can only do so much, and if you're going to really specialize, you're going to have to focus on that. And you can't just dabble. And it's like the jack of all trades, but master of none. You really got to focus, and that's really how Christ Hospital is. We've got experts in structural, outstanding structural docs, CTO docs, chip docs, IC, heart failure, EP, everything. So we're all kind of hyper specialized. And I think it's great for the patients that they've got
Mhm.
someone to go to that just does that, and they do a lot of it, So this just sort of fits in that mold, and we're trying to keep, specializing it more and more as we get, you know, further along the way. So I think it was that conversation that sort of got me to let go of some of the other stuff and focus more on the peripheral artery disease and limb salvage in particular.
And I just have a couple more questions that we ask every single doctor here. One is we call our journey to diagnosis because we want to raise awareness of the different types of misdiagnosis that are occurring with textbook symptoms of
Yeah.
PAD, such as diabetic neuropathy, back issues, sciatica, gout, arthritis, etc. So describe a case where a patient should have been diagnosed with PAD sooner but was not. And because of that, presented in your clinic on deck for complex revascularization and or amputation.
Yeah. Well, I can remember one distinctly early in my career, where this patient was getting hip injections, and you've heard these stories before. And claudication can be a tough one to diagnose because it can be so atypical. And the majority of the patients, they don't have those classic symptoms. But this patient was dealing with a lot of hip pain and buttocks pain and so forth. And he was getting injections and seeing a back doctor, and we were seeing him for a heart issue, and we started asking about his legs, and I said, it doesn't sound right that you're just not getting better. So we scanned him. Of course, he's got occluded iliac arteries. So it's one of
Oh, wow.
those, just to your point, where he's going down the wrong road. And we got him opened up, and his arthritis went away, his pain went away. So it's, sometimes these symptoms overlap so much that you can get on the wrong track. Um, and maybe even treat some things and go through injections or surgical procedures for other things. And it's actually a vascular issue. So it does masquerade a lot of other conditions, and you got to just be aware and check for it, especially with risk factors, the diabetics, like you said, the smokers and so forth. So we obviously have our antennas up, and we're always looking for vascular care or disease, but other doctors have a lot of other stuff on their plate too. At PCP, I don't know how they do it with everything they're trying to handle. So
Mm-mm.
it's just sort of thinking about vascular and these, and a simple ultrasound can get you that answer.
And finally, a moment with a patient. This is what our patient's favorite question that they came up with. A moment with a patient that still has you shaking your head. I can't believe a patient just said this. I can't believe a patient just did that. And it's
Yeah.
not to mock anyone, but they really feel like some of these situations others can resonate with
Yeah.
and they can learn from.
Well, I do have a patient conversation that I had that I'll never forget it. I still laugh. And it was a limb salvage case. He came to me with ulcers, non-healing ulcers, and a lot of pain. His main problem was the pain in his foot. So he came and we did a couple of procedures, got him healed up. He got released from wound care. And he came back to see me, and we're checking his feet out. He looks great. And I asked him, I said, listen, this guy's in his late 80s. He's about 5'4", 120 pounds, just full of energy, just a full energy guy. And I said, your foot looks great. I said, how does your foot feel? Does it still hurt? Because remember, his main thing was pain. And he said, my foot feels great. It only hurts when I'm kicking. He said the ass. So he's like, it only hurts. So but he got this little guy that, so it was great, great sense of humor. And I'll never forget it. But his foot was great, and he got into his 90s and still doing well, and still has his foot. So great story.
That's amazing. Thank you so much, Dr. Corl, for spending so much time with us. We really, really appreciate
Yeah,
you. I know you have to get to clinic, and so you don't have to cut anyone short, and you can spend lots and lots and lots and lots
that's
of
right.
time listening to your patients. So again, congratulations, our 2025 U.S. Compassion and P.A.D. Care Award recipient. Thank you from the bottom of my heart, Dr. Corl, for all you do. And we do have the person with us, Marcia, who was the very first of all the patients to nominate you for this
Oh,
award, who's here behind the scenes with us right now. And so, on behalf of her and all of the other patients that nominated you and voted for you, thank you for all you do to save life and limb.
thanks, Kim. I really appreciate it. I really appreciate you. You're a great advocate, and you've changed a lot of lives in a positive way, and I appreciate it. And thanks for the recognition. It's not just me; it's our whole system, the staff, and everybody. But I appreciate it.
Thank you.
All right, thanks.